Well, I'm very pleased to be here, and I thought I'd introduce Vermont a little bit. We are a relatively small state of about 650,000 people, so about the same size population as where we are now, the county Somerset now, but about 7 times the size in landmass. So we're a little bit very rural. We have about 20% of our land is in crop or pasture, and 75% of it is forested, actually. So we are called the Green Mountain State for a reason. It's mountainous, alpine, with some nice valleys where there's a lot of dairying that happens along the lake, and then some mountain dairies up in here, and that sort of thing. Because we are small and diverse population, one thing I regret is the lack of a pub that I can walk to about a mile away. So I have to drive, which is dangerous. So it gives you a sense of what many of our farms look like. We have a large organic industry, about 25% of the dairies. We have 800 dairies remaining in the state, and 200 of them are organic, and then about 40 farmstead or artisan cheese makers. So niche dairying is a large part of our industry, and an important part. All the organic dairies need to be pasture-based, so pasture-based dairy systems are also important to our system. Many tie stall barns with milking in the tie stalls, and then also some freestall facilities. We have a tough winter, if you will, and so we need indoor housing. Both swing parlors, normal parlors as well in the larger herds. So many of the pasture-based systems have adopted the Australian or New Zealand-based systems of swing parlors, as well as a few large herds of 1,000 cow dairies in commercial settings that are shipping fluid milk. And then emergence, just like the EU, because of labor issues, emergence of robotic systems, which is relatively important. So I thought I'd do a little bit of overview of what is mastitis. I was trained as an epidemiologist, so I study disease in populations with a focus on dairy cattle mastitis. You know, and you'll come across there are a lot of terms that we can talk about in terms of classifying mastitis, many dichotomies, acute or transient mastitis versus chronic and persistent. And there'll be some trends as we go on to talk about what really we need to focus on, probably at a producer level, to help reduce mastitis prevalence. And these chronic persistent ones are especially important. Classic epidemiologic dichotomy, contagious versus environmental. In other words, that describes the source of the organism for the cow. And then clinical versus subclinical. So mastitis cases that result in abnormal milk or abnormal cow, clinical mastitis, versus mastitis cases, infections that are subclinical. In other words, the farmer cannot, or we cannot observe them, changes in the cow or the milk, but they are there, and they lead to, for the most part, can be seen by, for example, a high somatic cell count, an increased somatic cell count, due to the inflammation caused by that organism. So a general list of the major mastitis pathogens. Our lab is focused on the Staphylococci, Staphylococcus aureus. They are listed, another dichotomy, listed by the basic groups of major versus what has been classically called minor pathogens, with the major ones being, this dichotomy being driven by the extent of inflammation they cause in the organisms cause in the mammary gland. So these are the big ones from a producer's standpoint that frequently lead to clinical mastitis, and then these are what is classically described as the minor ones. As I said, our lab focuses on the Staphylococci, Staph aureus, and then what's described as the coagulase negative Staphylococci, and you saw a whole list of those organisms, Dr. Montello's presentation earlier, but you'll notice that many of the organisms that were on her list that were sourced from the skin are not the same organisms that are associated with cases of mastitis. So, for example, Staph chromogenes is emerging as a really important of the CNS, the coagulase negative staphs, a really important staphylococcal species that is found in milk, but we tend not to find it as commonly on the skin or the teat of cows. And that will lead to some of the epidemiologic concepts that I talk about later on in the presentation. So first sort of major paradigm shift when we think about major versus minor mastitis pathogens is to think about these ideas of contagious versus environmental and host-adapted versus opportunistic organisms. And classically, we looked at these organisms, Streptococcus agalactius, Staph aureus, as strongly host-adapted and strongly contagious, spread from cow to cow, that sort of thing. And that holds true, it's still true, but this blocking of these organisms into major groups, and then we looked at organisms such as Strep disgalactiae, Strep uberis, and the coliforms, E. coli and Klebsiella, as strongly opportunistic and environmental. But with credit to Dr. Ruth Zadok's, who's sort of driven this approach, that this dogmatic sort of splitting of organisms into these groups, in fact, was never really meant to be. It's sort of a general trend to address how you might control mastitis or how you might address the control of mastitis caused by specific organisms. But more realistically, all of these organisms can be found on a scale in their contagiousness or their host level of host adaptedness. And some of these organisms, not shown here, like the coagulase negative staph, where they are classically described as environmental skin contaminants that may cause mastitis. As we continue with strain typing and tunneling down on molecular diagnostics, we recognize that there are probably some dominant strains that are associated with, that are more contagious than others, and thus associated with mastitis cases. This is also true for Staph aureus, what we study now. We see that many Staph aureus strains that are common in dairy herds may vary in their level of contagiousness, in their risk of transmitting between cows from cow to cow. And as well, the organisms that cause mastitis, the Staph aureus that cause mastitis, are different genotypes or different clonal complexes than the Staph aureus that we find in humans. So that's relevant to what we think about from a food safety perspective and a mastitis controls perspective. There are some exceptions, and they probably are important exceptions. The recent apparent emergence of what is called mastitis MLST ST8 in cattle populations, strain type 8 in cattle populations, is an example of perhaps a reverse zoonosis where the organism was a human host-adapted organism and now has jumped back, if you will, to cattle host-adapted. And with it, interestingly enough, it's brought antimicrobial resistance gene packages, beta-lactam or penicillin resistance, which, interestingly, we don't see as commonly in the cow host-adapted Staph aureus strains, like ST151. We don't see a lot of antibiotic beta-lactam resistance in that strain. So this concept of organisms being adapted to the host species and actually the terrain or environment, the niche, if I repeat, is probably pretty important. And we drill down and tunnel down on that. It will inform our decisions on control practices. To follow on that, to think about the organism adapted to the tissue, a few pictures, a cross-section of 2/4 of a mammary gland, and to give you some lay of the land, if you will, because as my initial mentors taught me, the mastitis happens in 4 ways: left front, left hind, right rear. All mastitis cases, for the most part, a generalization, emerge at the teat end, and probably are ascending infections at the teat end. So coming to the teat end, it's important to understand this anatomy and what organisms are present both on the outside and, more recently, what organisms may be present on the inside. And if we drill down on that, this is a histologic cross-section of this end, the teat end. You'll see that if you look at the tissues, the outside skin, the teat orifice, and the street canal, the interior street canal, that the epithelium actually is quite different there. So that makes sense. The terrain may be important. It may inform this, that the organisms that we find here may actually differ from the organisms that we find here, because there are different physiologic forces that are happening here. all the time, milk, or frequently, at least twice a day. Milk is coming through here. There's a large fluid dynamic force on those organisms. So adhesion is probably very important for those organisms that are surviving in this structure. As well as here, adhesion and being able to grow on a surface is important as well there. So with that, we can think about another paradigm shift, and I say at least for the food animal mastitis community, because this actually has arisen out of the human mastitis community. And that, so this, with credit to Juan Contreras, this can be driven by the mastitis we can think of as a mammary bacterial dysbios cone term, so a disruption in the biology, if you will. In the normal case, he shows the teat end with a flora or a microbiota that exists on the outer skin, as well as a microbiota that's adherent to the street canal or the mammary epithelium, and probably further up. And so this is the normal case where we have colonization of a diverse, many-colored, diverse group of microorganisms on that adherent surface, with many of them, some also being planktonic or in the fluids, living in the fluid stage, but many of those planktonic organisms probably sloughed from this adherent stage. In contrast, in the case of mastitis, now we have a dominance of a single organism in that both probably adherence to the skin surface as well as in the planktonic source. And he's trying to show here a little bit that probably many of those free-floating planktonic organisms are sloughed from this biofilm or this adherent source. Another thing to note between the two diagrams is the influx of inflammatory cells and the inflammation. And this may actually be quite important. It brings a question of, and references some of the emerging work happening with microbiome work in the gut about what is important for the normal commensal organisms and how they inform immune function at the mammary gland. And that's a large unknown for us today. So if I go back quickly, just looking at my time, we can see that this then informs what is actually happening in the teat end a little bit, and reference back to that. So subclinical mastitis, those organisms that are associated with mastitis, clinical events tend to be the tip of the iceberg. So clinical events are, if you will, the infrequent abnormal events that happen within a cow's life. And it's actually the subclinical mastitis events that are common. So this is a scatter plot of somatic cell counts for all the cows in a approximately 325 cow herd that looks at their current somatic cell count score and their previous somatic cell count score. So for producers, this is a tool that can be used to look at, essentially identify the problem cows, especially if what we're concerned about is persistent infections and long-term chronic infections and trying to eliminate those. So the cows that are down in this quadrant that have a low somatic cell count, below 200,000, let's say, in this picture, on both dates, are the cows that we worry about less. They're normal cows. They have no infection and previously of concern. And the cows up in this quadrant are the problem cows. And you can see in this herd that there are actually quite a few, 20% or so, of cows that have persistent infections of at least a month duration and that sort of thing. So these are the organisms that we want to target. And on this herd, they were mostly Staphylococcus aureus and Streptococcus ubris infections. Helping us pinpoint an area of concern for that dairy. This type of concept is not new at a population level, looking at subclinical mastitis being clinical mastitis being a small proportion of the subclinically infected quarters, and it references back to NIRD, work that's done here in the 70s, work that my mentor John Bramley came out of, the labs that my mentor John Bramley came out of, and it looks at the subclinical infection quarters in terms of mastitis is the more dominant state, if you will, and the state that we might best address. And as a result of that, some work that we've done has been looking to how to address those persistent mammary and intermammary infections. Because they cause a high somatic cell count, they are a source of new infections for individuals in the herd. So back to that gradients, Staph chromogenes may have a contagious nature, some of the dominant Chromogenes strains that cause infections. So chronic Staph Chromogenes infections may be a source for other infections in the herd. Certainly we know that for Streptococcus ag, so Strep ag and Agalactiae and Staph aureus, they can be important. Longer duration infections in a cow leads to a lower cure rate. Persistent infections flare up as repeated clinical cases, so they become very costly. And persistent infections starting in the dry period are especially a major cause of clinical mastitis early in lactation. My initial training is in mathematical and molecular epidemiology, so we did this in both a theoretical standpoint and in field studies to model these, to look at the status of cows, infection-free versus infected, short-term infected, or long-term infected, and cured infection, and the impact of specific interventions like antimicrobial therapy on those states or at the population level. And you can see that these new infection rates actually can be driven by the size of this pool because mastitis is a contagious organism many times. So the number of infected individuals in here will influence the number that become infected, if you will. And the number that you can make uninfected for whatever reason then will reduce the probability or the force of infection within that population. So cure is quite important. And we targeted a little bit of look to how does antimicrobial therapy during lactation and targeted therapy impact the potential to reduce this pool and force animals into the cured population, if you will, or move animals into the cured population. Reinfection is quite important, and interestingly enough, the data would suggest that this rate of movement back into the infection state from the cured state is that transmission parameter is 6 times higher than the rate of movement of naive cows that have never been infected. So once a cow has an infection for whatever reason and she enters this group, even if we cure her, there's a higher likelihood that those cured animals will move back into that infection. And we've done molecular diagnostics to show that it's not repeated chronic infections, multiple cultures of the same organism, but it's new infections caused by new organisms, which results in new cases. So it's something in either the management or the cow, including the cow level, that puts that cow at increased risk for infection. Of course, in our models, culling those cows with infections or increased risk infection is probably an important component of the economics of the decision to deal with those cows. And the economic standpoint leads us to find that in our models where we looked at using lactation therapy to move those cows from the infected state to the uninfected state strongly depends on the ability of the management level practices and the force of infection in that herd population. So on this axis, if we look at the transmission parameter, which we can define for either a herd population or a specific organism, lower is better and higher is not so good. And when you have management practices demonstrated here by post-milking teat disinfection, but that's not all, it's just a proxy for what may be stronger management to reduce the probability of transmission of organisms. When you have those in place, then the benefit of the total direct effects and indirect effects on the economic benefit of treating cows or trying to remove cows from the infected population is quite strong. However, if those practices aren't in place and your herd population is shifted out here for ability for organisms to transmit quite readily within the population, then introducing treatment management practices like lactation therapy is probably not advisable because these overwhelming infections within the herd, the transmission parameter overwhelms your ability to keep cows in that cured state. So it has a lot to do with the fact that those cows that have an infection have had an infection in the past are at increased risk for acquiring a new infection. And if you have management practices in place that drive a high transmission parameter, then those cows, even if you move them to that cured quadrant, they will quickly move back into the infection state. And so the economic benefits, if you will, is actually lower than the total effect because you get a lot of overwhelming reinfections because of the management practices that are in place. With that, it opens up some ideas for future opportunities, building on this mammary mastitis as a dysbios and a change in the microbiota of the cow and the cow mammary gland. And so one thing that we're quite interested in is understanding, well, what is the impact of antimicrobial treatment on the microbiome? Does the cow return to baseline? Does that cow's microbiota return to baseline similar to the naive cow, or are those cows that have been treated with antimicrobials, are they inherently different now in terms of their microbiota compared to those naive cows that have never seen an infection that we'll describe as normal and better protected? And then the impact of mastitis itself on the microbiome. Can this dysbios be persistent? So how long is that change in that microbiota persistent even after the cow has cured? Is the dysbios influenced by the host immune system? And data that Dr. Montal showed this morning would suggest that at least there is a breed effect, which suggests that there's probably a genetic effect. And you might take that further to suggest that there is actually a host immune response effect on that microbiota. And it's clear from the gut immunology and gut commensals that exists and is happening. And I would suggest that it probably also happens in the mammary gland. And then is that dysbios, is that change in the microbiota flora in that glandular tissue what helps describe the observation that those cows with mastitis are at much higher risk for subsequent reinfection? So that's the end of my story. A little picture of Vermont. We live on a really nice lake. On top of with the university on top of the hill and the university farm, a really nice place to do work. With that, I guess I'll turn over. Thanks.